This is what normal sleep looks like from the point of view of what your brain waves, the stages of sleep, are doing. We start off after a few minutes of wake, and this period of time, maybe anywhere from 2 to 10 minutes on a normal basis, how long you're awake when you're trying to go to sleep. Stage 1 sleep is a very brief transitional stage of sleep, just a few minutes. You're sort of in and out. I mean, if somebody just came to you and jostled you a little bit, right away you're awake with stage 1 sleep. So it's nothing to get you awake out of that. Stage 2 sleep's a little more, the commonest sleep, where 50% of the night is stage 2 sleep. You know what that means. Yeah, you could probably awaken from a disturbance. Might take a couple of minutes of that disturbance to go on, and you'd wake up from it. You don't have to be shaken necessarily from stage 2 sleep to wake up from it. Stage 3 sleep is the true, traditional, deep sleep, the kind where if you had your teenagers at a drive-in movie and you came home in the middle of the night and you could throw them over your shoulder in the car and drag them and throw them in bed, they wouldn't wake up. You know, that's deep sleep, really deep. Persons who are in it really requires a lot of effort for you to get them out of that. Then there's this thing here called REM, rapid eye movement sleep. We cycle through REM, rapid eye movement sleep, which means the time when our brains are active, imaging a dream, and the eyeballs are looking off in different directions at actually you might say at the movie of your dream in your brain. The eyeball muscles are working together so that you're looking in one direction with both eyes going in that direction or another direction all over. And that is a very interesting phenomenon, dream sleep. All animals, all mammals do have dreams and do have this type of sleep. It's very active brain time, but the muscles of the body during REM, rapid eye movement sleep, are limp, except the heart, of course, and the diaphragm. Most of the other muscles, including the chest that helps you breathe, and the neck muscles, and the throat muscles that help to widen the throat, are all more collapsed or limp. So if the muscles aren't working, that is a time when actually your breathing is weaker. Like if there's resistance it has to overcome. So we see that when people start to have sleep apnea, they first start to have it often in REM, when they're dreaming, and that's because the muscles are so weak, the diaphragm can't overcome the resistance in the throat working alone. With the throat, with the chest and the other muscles, it may be okay, but not during REM sleep. REM occurs about every 90 minutes, normally. Now sometimes people who are, let's say, on antidepressant medicine, a lot of people are on antidepressants these days, will have a delay in the first REM. It's later in the night. Sometimes people will have a delay in REM if they go to bed much earlier some night than they ordinarily do, because if the REM is more or less cycled to occur at 2 in the morning, and you go to bed instead of at midnight at 10, you might not have your first REM until later than you ordinarily would. But well, roughly, it's about every 90 minutes you'll have a dream. So people dream anywhere from 3 to 5 times a night. Each of the stages of sleep will have a different brain wave confirmation, and that's very important for us to identify. That's how I was able, or anytime I look at a sleep study of a patient, how I'm able to identify what stage of sleep they're in by looking at different conformations, different waveforms. So it is very meaningful. These different stages of sleep are not only something that we observe behaviorally or how hard it is to wake you up, but it relates to something happening in your brain, clearly.